I think what we're going to see is more and more diffusion um, of carving out these different services because of the demand. For employers to make ends meet, they're really going to have to watch the bottom line and do it in a manner that the interoperability with all the other health plan, other digital health solutions need to be truly connected. And that's where really the rubber's going to meet the road um, for employers. And that's what they talk about diffusion, I think we're going to see again and again. In order for you to stand out in this crazy environment that we're operating in, the macro environment where costs are just accelerating, you're really going to be able to demonstrate not only the cost equation, the simplicity for the employer, and the interoperability with the health plan.
B2B sales isn't broken, it's blind. Buyers don't see your value, deals die in the budget queue, and the best solution doesn't always win. Guy Talk brings the voices reshaping how you sell, win, and grow. That's Guy Talk, hosted by me, Guy Mobley. What's up, everybody? Welcome back to another episode of Guy Talk, where I sit down each week with C-suite executives, investors, strategists, and operators and investors, and talk to them about what really makes a difference in, everyday business, sales, running a team, leadership, whatever it may be. What separates the good from the great and the great from the elite? And today we have one of my good friends and my favorite people, Mr. Manny Menendez. He's a great human being, a very, very smart and knowledgeable healthcare industry veteran. He's been in the business for 3 decades and has extensive leadership across sales, strategy, and GTM execution. Manny, welcome on to Guy Talk.
Thanks, Guy. Awesome to be here, and appreciate that nice, warm introduction. Look
Yeah, I
forward
mean,
to our discussion.
I've been super excited to get you on. I mean, from when I first joined Beyond Banyan, you were one of the first guys that I really started talking to on a weekly basis, and it's been great to get to know you and just how deep and extensive your knowledge really goes. It's been truly special just to work with you. It's already been 6 months, hard to believe, to where we are now.
What they say, right? Time flies when you're having a blast.
It does. It does. Well, as I was kind of coming together, forming this podcast, I was like, what's some of the insight that Manny could really bring into our audience and our listeners, and really provide that, not to be cliche or pun intended, but the value that he can bring to our listeners on the podcast. And the first question that kind of came to my mind is, what's the pattern you've seen in healthcare companies that, they think they have a distribution problem, but in reality, they actually have a value communication problem?
Yeah, it's interesting, and it's changed so dramatically, Guy, in the last decade. If we sit in here, rewind the clock about 10, 11 years, this entire supply chain of what they used to refer to as point solutions, now digital health, wasn't even in existence. And now there's over 10,000 of these digital health solutions out there. And the number one challenge becomes is how do you become distinctive? How do you stand out and break through in every room you enter? And a big part of it is demonstrating what is the impact, the value that your solution drives. Oftentimes the number one competitor we see in the market to an organization not moving forward with a given supplier is a thing I call do nothing or inertia, right? And if you get the inertia decision, I would submit to that supplier, you haven't done a good enough job at being distinctive in articulating your inherent value. And that's really your problem. You're having the conversation with the broker, consultant, the prospect, but are you really able to break through? And if they're looking at 12 solutions and they have room to launch 3 new ones, how do you not only win your category, but win all the other categories that they're contemplating launching in a given year? So really, it's around how do you show that value, right? And value can come in many different forms. It's alignment with the strategy they have in place. It's what are the levers that they use to get people to actually be aware of the solution and actually engage in the solution when they have a need in healthcare. And then ultimately, let's be candid, value boils down to what's the economic equation? Net present value, return on investment, internal rate of return. And these days, if you don't have a demonstrated black and white return on investment, it's going to be very difficult for employers to move forward, just given the macro environment that we're all so painfully aware of.
And that economic justification piece that you bring out, like, you know, you need credible ROI is what we hear a lot of times. How has that definition of credible ROI evolved over the healthcare industry from the time you started to where we are now?
You're going to date me now. I was out in Seattle earlier this year at a storytelling keynote I was doing, and young 20-something-year-old asked me a question, and how do you know all this about storytelling? I said, well, that's because I'm old. She was like, Mr. Menendez, I suggest here's some feedback for you. You're seasoned. You're not old,
Yeah.
right? So
Right.
I've been around a long time to the point. But to your question, and why I brought that up is back in the day, this call it, turn of the year, Y2K, 2005, you kind of going through that first decade of this century. Big focus of employers were what's the performance guarantee, right? And what's the solution going to do? And what are you going to guarantee? Yeah, they would ask the question around return on investment and they would be interested in it. But you got to remember back in 2003, per employee per year cost to offer medical and prescription drug coverage was $2,300. Today, it's 15,000. So the investment's almost what? That's about 6x of an investment, 7x of an investment you have to do just to offer those two core coverages. So I would say back in the day, it was more around is the experience of the member seamless? And will the supplier guarantee the performance to a certain level? And then finally, how does it coordinate from what we're trying to achieve from a broader total reward strategy? And if those components came together, a solution had a good opportunity to actually go in place. Now, fast forward the clock to today. Again, I described the supply chain with over 10,000 digital health solutions across all the different categories at any given time, trying to get the mind share of these buyers. And the paradigm has shifted dramatically. And I'll start with return on investment because if you don't have a demonstrated return on investment, and here's what I mean by black and white, it's not theoretical that hey we're avoiding this cost downstream because you're doing these things. No, it's really hard dollar. I'll give you a couple examples of what I mean by that to bring that to life. I do some work, advisory work with a company by the name of Leap Health, and they're carving out the infusions for individuals, about 200 plus infusions that you may need for all the different conditions. And by carving it out from the hospital setting, healthcare setting, and taking it to freestanding or to the home, and by Leap Health actually creating a marketplace where you can go buy these infusions at cost, what they've been able to do is they buy them at cost, they pass through it at cost to the employer, and then they'll send their technician, their RN, nurse practitioner into the home and administer the drug for a couple $1,000s. That same drug, let's say it's a $50,000 drug, in the hospital setting could be 2, 3, 400%. So it could be $150,000, $200,000 by carving it out and being able to get it at cost. It becomes 50,000. That's demonstrated return on investment because instead of paying the 150, 200, yeah, the member's going to have it administered in their home by a trained technician and or in a freestanding facility, but you're saving boatloads of cash. So that's a very demonstrated return on investment. Another organization doing some incredible work is Elon Adler and team at One Imaging. Again, carving out MRIs, PET scans, just the imaging from the hospital setting, coming at, I think the numbers I see from them, 75, 80% savings. So again, when we talk about hard dollar return on investments, those are two prime examples where you're booking significant savings for the same damn drug, the same picture, whatever the case may be, but you're doing it at a fraction of the cost of what it would cost in the current health system.
That's that's just crazy for me to realize, right? Because this is my first job out of college, and I've actually started to think about healthcare costs and out-of-pocket costs, even for myself. To think about the stark contrast from, you know, 25 years ago to now is huge. To really to hear that and understand that. And now that you were just saying like 10,000 overall healthcare solutions. What have you noticed separates, healthcare organizations that break out into new markets successfully and others that get stuck in that initial niche that they launched into?
Yeah, I think the orientation and kind of I was listening to a state of the state podcast presentation done by an entity, and the two words they used for the state of healthcare was chaotic and diffused, right? And so um, I think what we're going to see is more and more diffusion um, of carving out these different services because of the demand. For employers to make ends meet, they're really going to have to watch the bottom line and do it in a manner that the interoperability with all the other health plan, other digital health solutions need to be truly connected. And that's where really the rubber's going to meet the road um, for employers. And that's what they talk about diffusion, I think we're going to see again and again. In order for you to stand out in this crazy environment that we're operating in, the macro environment where costs are just accelerating, you're really going to be able to demonstrate not only the cost equation, the simplicity for the employer, and the interoperability with the health plan.
Hmm. And I've heard you use those words chaotic and diffused, and I'm sure there's got to be some misalignment as well. Um, and maybe this is kind of a switch of conversation per se, but what's kind of the hardest lesson that you've had to learn about aligning product, uh, payer, provider, and patient incentives when introducing a new healthcare solution?
Yeah, that's a tough one because guess what? Everyone has their hand in the cookie jar, right? Ultimately, and there's a lot of dollars flowing around the healthcare system. So I think what you have to, when you're looking at any new solution for an employee base, let's just say, is obviously what you want to be able to do is offer a valuable benefit if you're the employer plan sponsor, the ERISA plan sponsor, offer a really valuable benefit at a really cost-effective price point that your employees are aware of, can access with ease, and the experience is simplistic and straightforward. And so that's really top of mind for the quote unquote, I'll call it the purchaser of healthcare, because in a commercial employer mechanism, that is the purchaser of healthcare. Ultimately, um, the commercial employer does business with the health plan, right? What does the health plan bring them? All the different third party administrative services around adjudication of claims, member services, prior authorization, all the utilization management type things. But also, a big part of what the major health plans bring is a managed care network. They've done all the work to negotiate the broadest networks, managed care networks, but the deepest discounts, right? And with volumes that
Hmm.
these health plans bring to these systems and providers, they're able to have negotiation leverage and get the best rate. So ultimately, from that constituent, you want to you work closely with the health plan because again, they're giving you the best discount. Now, from a provider perspective, that's where it becomes a little bit difficult when we talk about this diffusion, because you start carving out these different pieces of the equation: MRIs, PET scans, infused drugs, you know, other dialysis is another category starting to be carved out. All of a sudden now that's taking revenue away from the health system.
Hmm.
And think about the current environment of the health system where there's cutbacks in Medicaid and Medicare, right, from the government. and then they're losing other commercial business. Obviously, what that's going to do is health systems operate on razor thin margins in this country, and they're going to have to start to continue to raise their prices to keep the doors open, so to speak. So, obviously, what I'm describing here is a very tangled web, but ultimately,
Right.
my lens is always how do you offer valuable benefits to the employee and do it in a way it's easy to access. And the health plan's a main actor in that because of the negotiated leverage they have with these major health systems.
Hmm. And I mean, that's a great piece of advice that you had right there at the end. Out of, all the 30 years of your experience and the things that you've seen and you've lived through and you've learned, and now you're like that young girl said, like, or she's my age, I guess, you're
Yeah.
seasoned at this point. What's the great advice that you've come to learn or someone has shared with you that you would share with any early stage, company in digital health that's trying to make a go for it?
Yeah, it is have conviction, have passion, have a belief on what you're bringing to market. A big part of when I do some venture capital work, and a big part of what we do there is um, first thing we look at is do we like the founder? Do we believe in the founder? Is he or she passionate? What is their origin story? Why are they starting this company? Asking before we even get into the solutions and the mechanics on what it can do and what the economic model is, we just try to get to know the founder in and of themselves. Then what we do is we go to is their product market fit, right? Number two. And then number three is do they have a vision, right? And it kind of ties back to the earlier question of do they have a vision on where they're headed? And you asked me about the niche, which I don't know if I fully addressed that question, but let me tackle it now. Is if you're entering with a given service, what's your roadmap look like?
Mm,
Where are you going to be in 36 months? And how can an organization that signs up with you today, maybe it's a second opinion service or it's a care navigation, whatever the service is, what is your roadmap to continue to innovate and ideate and advance your solution that the employer can grow with as well? And is there alignment of vision on what a given employer wants to provide for their employee base with what the vision of that niche digital health supplier that's going to bring? So that's a key part we also look at is are they a one trick pony or are they constantly innovating and have a solidified 24, 36-month purview on, hey, at the end of 2028, this is where we're going to be. And if we do A, B, and C and generate this type of impact to our constituents, i.e., our clients, our top line, our EBITDA margin, we'll deem this to be a successful growth business.
mm,
So it really is thinking. I always say instead of thinking vertically, which is more niche, you got to think horizontally, and almost like the analogy of Wayne Gretzky is you got to skate to where the puck's going to be. And you want
mm.
in digital health, those that win are those that have a vision on where they believe the puck's going to be, and they have a game plan to get there.
That reminds me a lot of kind of Jeff Bezos's story with Amazon. It started as a bookstore, but he had so many ideas. He was like, I got to keep innovating. I got to keep moving, and this is where I think I need to go. And he went. That just sounds like that advice lines up like very well with the success story of Amazon, I think as well.
And with all the ideation and innovation you need to have, again, to continue advancing the ball, I would share with the audience you have to have a fair amount of discipline, right? Because what you don't want to do is have all these different ideas and become, I had a board member once that told me, let's not become unfocused or the plural of focused. I asked him, what's that? That's unfocused. Because you have all these different ideas, but you're not
Mm,
taking a stance to say, hey, of the 20 ideas, only six make sense. First two we got to launch in the next 12 months, and then we'll get to the other four 12 and 24 months in. So that takes a lot of discipline, right? Because all these ideas sound
right.
great, but when you look at an idea and you're going to deploy it with respect to advancing the product fit or the services offered, what's it going to do for your clients, which is the ultimate consumer member, right? Um, and the experience that they have, and how is it going to continue to control the trajectory of the cost, right? Because Lord knows, 20 years from now, I don't think we can afford, PEPYs at 45, 50K, right? If we're on the same
Right.
trajectory as the last couple of decades.
Mm. Well, Manny, I want to ask you one last question before we go, and
Okay.
it's really more so around, everyone that's currently in the health and benefits community. What's one solid piece of advice that you see is, changing the healthcare industry rapidly, or would maybe change their day-to-day business, if they just realize this one thing that could help them become successful, or, always skating towards the puck, like you said earlier. What's that one piece of advice that you would share?
Yeah. So, you look at the healthcare system, it's 20% roughly, a fifth of the GDP, right? Roughly. And so I love the fact of all the innovation out there is much needed. Period. My advice would be is fail fast. When you tee up something, maybe your initial idea of your business, or bringing on people that maybe don't operate as well outside the walls of a corporate structure in an early entrepreneur type environment, is fail fast and make decisions to pivot on individuals that can't succeed in this environment. Because as you're a young, nimble organization, every individual matters big time. And an
Mm,
idea that maybe is not going to fit, you got to have the intestinal fortitude to pivot quickly, accept a failure. Michael Jordan, how many times did that guy fail? He didn't make his varsity team in high
right.
school. And I would submit, I'm a Chicagoan, that he's the GOAT. So that's my one piece of advice. Don't be afraid to fail fast and pivot, because when you do, then you're making change and progress.
And I think that's an excellent piece of advice, and it's one that stuck with me since the first time I heard it from you. Is fail fast and pivot quickly. So, but Manny, thank you so much for taking this time out of your day to
Thank you.
jump on a guide talk, and the extensive amount of wisdom that you have, and I'm sure like in the 20 minutes that we just shared is going to be incredible value add for so many people out there that are listening. So I want to thank you again for joining Guide Talk, and I can't wait to have you on the next one.